I always had some good, strong teeth, and they were nice smile and everything. And then as I aged and I didn't take care of them like I should, they began to crack and they began to fall out. And the next thing you know, I had teeth like this. And I have to have something done to them. And so I went to a place and they, of course, took them out and I have this smile. And then they gave me a new set of teeth. They really weren't very good. So then I got a hold of Dr. Emett, and he said, well, I can make you some nice teeth. And so today I'm hoping to have a nice smile again. And that's my story.
Hey, there he is. Well, Jim, how are you today?
Oh, we're doing okay.
Oh, good. Hey, this is my good friend. This is Dr. Logan Loft. Yeah, I think you talked to the CRNA that does anesthesia. That's probably who you talked to already.
Yeah, that's who I talked to.
So we've been over your case a lot. You and I have talked about it quite a bit. Yeah. So I just want to review it. So we have no teeth on the top. We're going to put 6 implants up there.
Right.
We got a few down here on the bottom. We're taking those out.
Right.
Putting 6 implants on the bottom.
Right.
You're going to leave today with teeth on the top and the bottom that are held in by implants.
Right.
And then also today, if there's an opportunity to do it, and we think you might need it, we might do a little procedure called the sinus lift. Okay. So if we need to add a little bit of bone up here into your sinus to help us get prepared for something in the future, just to stabilize the implants, we might do that today as well. Okay. So do you have any questions for us today before we get started?
I hope that when these are put in, I keep biting my jaw over here, back in here.
Yeah, the teeth are all designed and pre-planned to keep your cheek out of the way. Right. So we may still have to do some adjusting afterward because you'll be pretty groggy when you wake up today after we've got the teeth in. So we'll get you back in and Dr. Emmett's gonna adjust them and make sure you're feeling pretty good.
Sounds good.
Well, it's time to come back with us now. So we're gonna have you stand up if you need help, or can you get up here? You got it.
No, I think I can get up.
All right, I'll open this door here. We're gonna go right through this door back here together.
All right.
And we'll go back to the operatory. Superstar headed back.
Oh boy.
You're gonna come right in here.
Last I had this drink was about, I think I took a few sips of water at about 10 o'clock.
About 10 o'clock, that's perfect, that's perfect. I think you started to get you super relaxed, get you started, okay?
Yep.
Okay.
It looks like one of them turkey thingies.
Yeah. Looks like a turkey baster.
Yeah.
It's not for those that are afraid of it.
Well, partner, it's almost time.
Yeah, and here I'm going to be asleep and miss the show.
You're going to miss all the good time.
Yeah.
As soon as you go to sleep, we turn the radio on, we start dancing.
I imagine.
We have a great party.
That's the way it goes. I'm
always not there?
Yeah.
Well, we'll make sure you have a good time. I promise you that we're going to take great care of you, and when you wake up, you're going to have some amazing teeth in there.
All right.
So as soon as
I'm anxious to see him.
Yeah, it'll be a good time. And then I get to see you again tomorrow because you come back for your 24-hour appointment.
Threads hanging out all over.
Yeah, you'll have some threads hanging out a little bit.
Yeah, I bet you that'll make a nice video.
Yeah, we'll get a video of your nice threads hanging out your mouth, yeah. Well, give us one big smile real quick. Let me just take a look. You can see we've got just a few teeth down here on the bottom. We're gonna get those guys out of there. We got no teeth up on top, and you're gonna look like a totally different guy when you leave here.
Oh, man.
You're gonna change your name to Handsome Jim.
Well, I've never been that before.
Yeah, you have. I saw that picture of you from when you were in high school.
Well, can I play the guitar when I get through here?
Probably not, unless you knew how to when you got here.
Yeah, well.
Well, let's give one final wave to those last 5 teeth. They are all done.
Bye-bye, boys.
Bye-bye, boys. You're out of here.
You've done me well.
Yeah.
83 years.
83 years young? Woo.
Yep. What started that was my wisdom teeth, or my jaw teeth, always came in instead of up like this. They
came in sideways.
When they took them out when I was in the Army. Whoa. And old Dr. Peters, I'll never forget him.
Do you remember your Army dentist name? Dr. Peters.
Dr. Peters.
So we've had this conversation, but I was in the Army. But what you don't know is Mitch here, your anesthesiologist, he's kind of a big deal. He'll laugh it off and act like he's not a big deal, but he's a lieutenant colonel.
Yeah, well, this is old Colonel Peters.
There you go.
You don't put the bag over your mouth.
Oh no.
Breathe in.
Not like they used to do, huh?
Breathe in.
So we've got a wonderful case today. He came in with no teeth on the top, so just his gum tissue. He's wearing a denture. So when he leaves today, he's going to have teeth that are in, but more importantly, his gums will be pulled up onto those teeth so that we can start to get that nice scalloped contouring to make him look like his natural teeth that he had. And he's been in a denture for a really long time, and he brought us a picture from when he was in high school, and he said, I'd like my teeth to look like that. Well, we're gonna do our very best to get him to look like that today. We're about halfway through his treatment, so I just want to do a quick update. I think the most important thing for you to be aware of as somebody that might be considering a 3-on-6, maybe you want to know how the surgery goes, is just how calm and smooth the patient is. They're having an amazing experience, right? No pain, they're having a nice nap. We have a great anesthesiology team here that's keeping them super comfortable. So we're able to do the work the right way. So are things going pretty quick today? They are. Our patient has no idea what's actually going on. We're about to take some teeth out. They're numb, they're totally asleep, and we're actually a little bit ahead of schedule, which is nice. So as you're considering one of these cases and you're considering going through this treatment, I thought it would just be nice to see, like, we're halfway through. The patient's been like this for a couple hours now, and they're still very calm, very comfortable, breathing on their own, and everything's going awesome. So one of the things that makes this procedure so achievable and makes it so we can do it in one day is technology, right? So I wanted to just show you a couple things that we have in our office that you wouldn't normally find in a traditional dental office. So that would be what's called a printer. So literally, after we took the scan on this patient while they were sedated, then we were able to print out their temporary. So when that patient leaves today, they're going to be wearing that. Now it's going to be screwed in and held in on the new implants we placed. So how long is this going to be in your mouth? The answer is at least 3 months. So you'll notice it's one solid piece. Well, a 3-on-6 is 3 bridges. Why is it one piece? This single piece is what's going to help stabilize those implants really good for a full 3 months of healing. When you come back in for your second set of temporaries, that's where we give you the 3 separate bridges, and those bridges you only have to wear for a couple of weeks to maybe a month or so while you and your doctor evaluate the look, the color, the shape, all of those things before we make your finals. So one solid piece on the day of surgery, and then you wear that for about 3 full months. But without the technology, this isn't possible. So if you go to a 3-on-6 office, they most likely are going to have a printer, but there's a lot of pieces that come together to make it so that when the patient comes in for surgery, you're going to leave that day with teeth in your mouth that are really nice looking. So surgery's all finished now. Everything went perfect. We've got those implants in on the top and implants in on the bottom, and he's just waking up now and getting ready to go home. But you can already see those teeth up there. They look gorgeous. So it feels weird because you're totally numb, right?
Raise my nose so you
Nose job.
Raise his nose so we can see those teeth. So we'll see you tomorrow for his 24-hour follow-up, and then we'll see him a little bit while after that.
I just fixed your hair.
Whew, looking all handsome, your hair's done, and your teeth look good. That's a triple threat.
But you just gotta be careful, you know?
Yeah, I'm a little groggy today.
Yeah, that's to be expected.
In fact, man.
Hey, those look great. My word. And you're walking in here, you're not in too much pain.
I haven't had a bit of pain.
Well, that's wonderful. We took a lot of extra precaution to help make that possible. We've got our good friend Jim here. He's back for his 24-hour checkup. We've got to make a few little adjustments to his teeth. So he came in today saying, hey, my teeth don't come together quite right. I got a few little places that feel out of whack, and that's normal. So that's why we do these 24-hour checkups. So we're testing his teeth today, seeing where they're hitting and getting those little adjustments made for him. But Jim came in today in zero pain. Had a big surgery yesterday, and today shows up and has no pain whatsoever. Is that normal? We'd like it to be normal. In his case, this is wonderful, and we like to have that happen. But these appointments can be pretty quick. Make some adjustments and get him out of the dental chair and get him back home. Sound like a good idea, Jim?
Yeah.
Okay. I thought you'd agree with that.
Yeah.
All right, open up for me. Good. Little chomp, chomp, chomp. Grind around a little, right to left. Perfect. Open up for me. All right, a little teeny adjustment here, okay? All right, bite together right there. Good, grind around a little. Nice, open. Bite together and squeeze. Good. And over here again, bite together, hold.
Well, that's better. I don't think I crack my teeth when I talk now.
Oh, good.
You're gonna get used to that anyway. Those teeth are gonna start hitting again. They haven't for years.
Yeah. Yeah, I think I'm pretty well satisfied so far.
Well, let's get you up from leaning back in this dental chair.
Oh. Yeah, it's been quite an episode.
You look great.
Grab my arm, let's spin your feet over this way and get them flat on the ground.
Remind him of
Tell you what, I was afraid of that turkey baster.
Yeah?
And
That's what makes you happy.
lo and behold, I don't even remember when you put it in. And then I kind of woke up and man,
You're back.
I guess I'm back.
Well, I was super happy with how everything
So
went.
and you know, I was expecting a pain,
Yep.
and
How is your pain?
I have had no pain,
Very good.
absolutely none. I'm a
Very
little
good.
groggy yet this morning.
Yeah. I got a chance to
Yeah,
meet
you
young
did.
man. Hey, best of luck, okay?
And I like them hats.
Yeah.
That's pretty good.
Yeah.
So I came in today, we got your teeth adjusted. They're feeling better, right?
Right.
That's normal at your 24-hour appointment, got some misalignment. Now we're gonna have you come back in a week.
Okay.
And in one more week, we're gonna check everything again, make sure you're doing good with it.
We'll grind them some more.
Yeah, that's right. And then the next time I see patients normally is not for a couple of months because we
Okay.
have that full 3 months that we
Right.
gotta wait while you're in your temporaries.
Yeah.
And then we'll make your next set of temporaries.
Okay.
But you're here today, no pain. This is an easy adjustment. And they look great. And the thing that gets it for me though is your smile looks amazing.
When do we take those stitches, or are they the kind that go away?
Good question. I'm glad you asked that. They're the kind that just dissolve on their own.
Okay.
So it's going to take 3 to 4 weeks for those to go away.
That's all right.
And those go away on their own.
I couldn't see them anyway.
Yeah. Yeah, most people can't see them. Well, let's give one wave to the camera, a big thumbs up. Everything went great.
Well, I tell you what, and thank you very much.
Yeah, you're very welcome. It was sure great to see you today, and I gotta go get to my next patient.
Good.
All right.
Go treat them as well as you did me.
I'll do that. Okay. All right.
Just call me Smiley.